Alrighty, so we're going to talk today about some pain management education for the patient in the simulation. So some of the things I recognized in this whole scenario was that there wasn't much education provided to the patient. And I think that as nurses, it's our responsibility to kind of take what the patient's saying and elaborate upon maybe some lack of knowledge or the need for further investigation to see if the pain management techniques are appropriate. So there's a few things that I think we could have done better in this scenario. I think I first would assess the pain. I would see if there's a need for possible more pain medication. Does she need the Percocet? Um, what would she be rating her pain? Is there a change in the pain? So I think all of those things are very valuable information that we need to collect. I think educating the patient that the pain should be improving, not worsening. If she does have any worsening pain, sharp pains, a change in her pain, that she definitely needs to notify her physician after she's discharged, just because this could indicate, something else is going on. So I think there's a missed opportunity to provide that education. I also think that educating the patient about the drugs that we're giving her, so about maybe why we don't give the Percocet at discharge, that she's a brand new mom, it can cause other side effects like constipation, foggy headedness, inability to drive, things like that, where there's a safety level involved. I think educating her that this is why we don't prescribe the narcotics at discharge, and also why we do prescribe Motrin, that all the moms are using it, and that's kind of the standard at discharge, and just kind of providing that extra level of education that this is totally normal. It'll get better, just why we're doing that, and why the physician doesn't prescribe a narcotic like Percocet at discharge would definitely be beneficial to this patient, just because she seems like she doesn't really have a basis of why we're doing things. So I think really explaining everything that's going on, why we're using the Motrin, why we're not giving her her Percocet, is a big piece of education that we need to do with this particular patient. I would also take the time to educate her about how she's supposed to take her Motrin. So, every 4 to 6 hours, one tablet. If her pain's not being relieved, or like I said, changing, then she definitely needs to call her doctor. So providing that education that this is how you're supposed to take your Motrin, when to call if it's not improving. And then the patient noted that Motrin makes her stomach hurt after the nurse explained that she was going to be taking Motrin. I think doing a little investigation into this comment would be beneficial, just to see, was she taking a lot of it all at once, proper dosing? Was she doing it on a full stomach? Was she doing it on an empty stomach? How long ago was this? There's some different things that could be going on that we could educate the patient to provide a little bit of reassurance. So I think definitely figuring out the scenario behind the last time she took the Motrin would be beneficial. Educating her that Motrin should be taken on a full stomach to prevent some of that upset stomach feeling that some people do get. Or also, if it's a heartburn related thing with it, that we could notify the physician and maybe get her a prescription for that as well. So there's a few things we can do to really help her be successful with using Motrin, and also just, doing our job and seeing what was exactly going on. I also think we should provide the education that, if she does experience tarry stools, or bleeding, or an increase in pain in the stomach, if she is getting some of those side effects, that she definitely needs to stop taking the Motrin and call her physician. So I think not just brushing it off that, oh, she had pain, is something that we need to do, and providing her that, yes, that is a side effect, but there's things we can do to hopefully help prevent that from happening, to where Motrin might help her rather than make her feel worse than she already is. And then I also think just letting her know that, that pain can happen, and she needs to notify us as if anything has changed. if the Motrin's not working or if she is experiencing some of those side effects, that we definitely need to know, because we're there to help her be successful at being, a mom and a patient at the same time, that she is recovering, and that, again, it's normal, and, that we're there to really help her out. I think giving her the contact information and educating her on when to call and how to call is also very, very important. Some other techniques to help cope with pain, doing some deep breathing techniques, using the sitz baths if she's having some of the pain from actual childbirth, or if she had a C-section, splinting. Those are all things that we can do to help educate her, different ways besides prescriptions, meditating, using a cold pack if that helps. So just different techniques to kind of alleviate some of that pain that she's feeling without having to focus on different pain medications would also be really beneficial, and help, again, reassure her that this is very common, and that she's not the only one who's experiencing this, and here are some things that have helped. So I think really just communicating with her, going through all of those different steps would be really beneficial, and something that the nurse definitely didn't do in this scenario, and something that for all of our patients we can go over with them and really try to help alleviate some of their pain.